Okay, so for those of you who have never heard of Dr. Richard Horowitz, you're in for a treat. I always say that when Dr. Horowitz is in the classroom, so I'm going to continue saying that because it's true. And so today we're going to talk about pre, post. What do we know about COVID at this point? Because the last time, I don't want to do too much of an intro because I have to do the intro post, which is for the people that are on podcast. Okay, so fasten your seatbelts because we're going to learn and grow together. Here we go. It's time to DAX, Dr. Horowitz.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here. Right here, and when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friend. It's so nice we can meet each other on the air on this beautiful best day ever. And for those of you who are tuning in for the first time, you're in for a treat. Please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Now, I don't know if any of you have this book in your library, but everybody that watches this classroom today, if you don't have it, please go either to, I think it's Amazon or your library, whatever it is, you can go to Dr. Horowitz website. It's cangetbetter.com and learn how you can take your health back. So about 10 months ago, we had Dr. Horowitz come on to the classroom, Lyme expert. We were going to be talking about Lyme, but it was around May 2020. And what ended up happening was talking about COVID, all the research that Dr. Horowitz had been doing. And this is like a follow-up, not just that. Many of you have had COVID and don't know maybe how to follow up with it, post-treatment, pre-treatment, what's going on, updates, not only for COVID, but also Lyme disease. And Dr. Richard Horowitz, who I absolutely adore and trust, is going to lead us with the path. He's been leading the path on all this information that we can do to take our health back. And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Horowitz is here to do just that. Thank you, Dr. Horowitz, for being here today.
It's my pleasure, Lillian. Always great to be with you.
Yes, yes. And I hope that you guys start tagging friends because there's a lot of fear of the unknown. Share a little bit about your background, Dr. Horowitz, and how you got, from Lyme, which that's become your expertise. You've even been a part of the Congress in Washington, and now you are really strong. Your studies and research about COVID. Share a little bit of how that's happened for you.
So the reason I got involved in COVID, obviously, is my patients were, of course, concerned when the epidemic started. But it was interesting when I was starting to look at COVID early on and see how the virus was affecting the body. It was obvious that what I call the three I's in Lyme disease, infection, immune dysfunction, and inflammation, those three I's that were affecting patients with Lyme was causing exactly the same process in those with COVID. So, of course, the infection's different. In Lyme, it's a bacteria, Borrelia burgdorferi. This is a coronavirus. But the inflammation and the immune dysfunction is exactly the same. In fact, the inflammatory molecules that get produced in Lyme were showing up in the early studies on COVID. So what I decided to do was to take some of the methodologies I had used to treat Lyme, which is blocking these inflammatory molecules. When you're killing off the Lyme bug, Borrelia, people get what are called Herxheimer reactions, which is an inflammatory process in the body. And the way you shut it down is by using nutraceuticals, certain natural products like N-acetylcysteine, NAC, alpha lipoic acid, glutathione. We tried this in the COVID patients early on with pneumonia, who were short of breath, who had fatigue, headaches, aches and pains. And lo and behold, within an hour of giving high dose glutathione, 2,000 milligrams, the shortness of breath started clearing and all the COVID symptoms were going away. So we published our first study on COVID and using these nutraceuticals, especially high dose glutathione. We published it last year in April of 2020 in the Journal of Respiratory Medicine Case Reports. Interestingly enough, 1 year later, the article has been quoted in other journals about 80 times.
Wow.
So I was the first doctor actually worldwide who published on COVID and possible glutathione deficiency playing a major role, because when you get this amount of inflammation in the body, one thing that showed up early on, this is way before COVID, is that if you get a viral pneumonia, a bacterial pneumonia, or you get what's called ARDS, acute respiratory distress syndrome, which is inflammation in the lungs with a whiteout, what these have in common is low glutathione levels in the lungs. So these have been published way before COVID ever came out. And when I saw that the molecules, the inflammatory molecules, were very similar in Lyme and COVID, we just applied what I learned from Lyme to COVID.
Mm-hmm.
And now 1 year later, we've treated about 65 patients with ivermectin, which is a generic drug. It costs $20, $30 for 14-day supply. There's over 26 studies, 10 of them randomized trials showing efficacy and safety. And we're using it with high-dose glutathione and nutraceuticals that I'll discuss with you today, like zinc, vitamin C, turmeric, curcumin, broccoli seed extract, sulforaphane, glucosinolate. And we're just having great results in especially acute COVID. And now we're approaching the long haulers, those people with chronic symptoms. Now we're going to see if it works for them too.
You know, this is exciting because I remember back in May, it was all so disjointed. We're getting so much misinformation. And when somebody would take a stand and say, no, wait, that's not real, they would start, censoring them or taking them off the air. Have you experienced anything like that, Dr. Horowitz?
Oh, absolutely. Anyone on Facebook who has discussed protocols that we use, the teachings that I got long ago when I got out of medical school is, of course, benefit as many people as you can and relieve suffering. And of course, when I found that these protocols I was using were working, I put it on Facebook. And eventually, as millions have found, Facebook censored me for 3 days. I was unable to post. So what I did is, instead of then posting these protocols on Facebook, I now have it on my website, www.cangetbetter.com. If you go on the website, you'll see there's a COVID tab, and there's 2 documents. One is the document, which is my prevention and treatment protocol for COVID. I'm taking these prevention supplements, and we'll talk about them a little later on. And then there's a randomized trial that I'm trying to get through at the University of California, Irvine, to prove in a study that, in fact, this protocol will work in preventing people from going on and getting ill.
Well, okay. So back in 10 months ago, you had mentioned that because people were excited about what you had been doing, that you were going to do a random study. And so this has still not happened?
It's sitting in limbo for 3 months. Initially, the study was a 28-day crossover design. The university came back to me and said, it's too expensive. It's like 1.3, 1.4 million. They had quoted the primary donor, I think 300,000 initially. So that kind of pissed him off a bit. So I went back and I redesigned the study as a 14-day study, because there were now so many positive studies on ivermectin. I said, well, the most important thing for me to do, because there's been no studies done on this whatsoever, the primary hypothesis as to why people are getting sick with COVID is glutathione deficiency. Glutathione deficiency is the primary antioxidant that you have in the body. So when you see with COVID that people get inflammation and it's affecting the heart, the lungs, the kidneys, right, all over the body, the brain, with strokes and all of these different side effects with clots, it's from inflammation. So no one yet, to my knowledge, has done a study on glutathione and COVID. And we're trying to get this done where one arm of the study is high dose glutathione with NAC, alpha lipoic acid. Those three supplements block a switch in the nucleus called NF-kappa B, which shuts down inflammation, same inflammatory molecules, Lyme and COVID. We then have another layer of nutraceuticals, curcumin and broccoli seed extract, sulforaphane glucosinolate. Those two are called NRF2 activators. They lower inflammation through a separate pathway than blocking NF-kappa B. And then the third pathway we're using is zinc, which causes your macrophages, your cells in your body that gobble up the viruses and help with inflammation. We're using zinc and beta-glucan to both stimulate the immune system to raise natural killer cells and T cells, the cells that go after the viruses, and also to have a healthy, balanced immune response. So one arm is ivermectin and a multivitamin. One arm is ivermectin, glutathione nutraceuticals. We measure before the study starts, how's your glutathione levels, what's your level of free oxidative stress. So we measure all these different inflammatory markers, and then we follow patients during the trial and then afterwards for several months to see if we can prevent people from, if let's say they're on the outside at home, we want to prove we can prevent them from going into the hospital. If they're in the hospital, the study is designed to prove that they won't go into the ICU on a ventilator. If they're on a ventilator, the study is designed to prove that you don't die or can get off the ventilator by basically using glutathione and ivermectin in the ICU. So it's never been done. It's really I think, an essential study that needs to be done for COVID. But I think part of the problem right now is I'm dealing with natural substances. Ivermectin is off patent. Merck right now is looking at a new drug, molnupiravir. I can barely pronounce it. They produced actually ivermectin, which is off patent years ago. And now they're looking at a different one. And my concern is with medical politics that the FDA may approve this new drug by Merck, which will not have long-term safety studies when there's over 26 studies in ivermectin showing efficacy. And just like hydroxychloroquine, it's been put down. And it's just medical politics at work. My experience is the drug has worked great. A lot of my patients swear by it. And I don't think 65 patients later, it's just a simple coincidence.
No, no, no. It's and I'm sure that the reality of what you're saying has sunk in after 10 months. I mean, you would think that every newscast would be at your door saying, Dr. Richard Horowitz, please share this with the world. Since you do want to share it anyway, why don't you share it in our station or our station or our station? And that's not happening, is it?
Well, the way medicine works, until you have a randomized controlled trial, it's basically experimental. People can't really say, and it's true. I mean, 65 patients is great, but it's not a randomized trial with, let's say, 200 patients. But it does build on the prior work in the literature on the role of glutathione, the role of curcumin, broccoli seed extract. There were studies published on curcumin turmeric that it may actually help stop the virus with the ACE2 receptors. The broccoli seed extract was just published about a month ago, immediately stopped COVID symptoms from progressing. So, it's been studied in small groups, but we've never studied this in a larger study. Now, if we do get the randomized trial, and one of my patients who is very generous gave $100,000 to the University of California, Irvine. So I think maybe he may push them a little bit in the right direction to get it done. I'm just waiting patiently at this point. I just hope it will be done because I think it's going to benefit a lot of people.
Yeah, and I know that you have a true heart to help people, spirit, mind, and body. When I first met you, and I learned that Lee Cowden was one of your teachers as well as a teacher in the classroom, I knew that you truly wanted to step outside the box. Many doctors are still in the box, poo-pooing all these other nutraceuticals that are, but behind closed doors, I really do believe that the people want to do the nutraceuticals. And because the doctors don't feel at liberty to speak out like you're speaking out. And, I find it very interesting that hydroxychloroquine, ivermectin that have had so many trials would be trumped by remdesivir. That's like what, $3,000 a treatment? versus
Well,
$30.
and it's not just that. The remdesivir has never shown in studies that it prevents death and mortality. It just showed that it lowered hospitalization rates by a bit. The only drug so far that's really done any of that is dexamethasone, which is non-specific. It's just basically shutting down your immunity and your inflammation. But I think glutathione is probably going to trump using dexamethasone, simply because if you have an underlying infection, and you give dexamethasone, that infection can come out, like tuberculosis, or if you have cancer, it can bring out non-Hodgkin's lymphoma. You can't just suppress the immune system non-specifically. That's not the best we can do. If glutathione deficiency is the primary mechanism driving illness in COVID, then the answer is give NAC, which helps your body to make glutathione, and then give high-dose liposomal glutathione. And in the ICU, in the study we designed as a pilot study, it's IV glutathione. One of my ER doctor friends in New York City who got COVID early on in the pandemic had long COVID, or what they're now calling PASC, post-acute sequelae of COVID, which I like to call the acronym PASCC as a pitiful attempt at solving COVID, not post-acute sequelae. I mean, I honestly give it names, but don't tell me what the cause is.
Yeah.
And this ER doctor could not go back to work. He sent me his x-rays. He had bilateral infiltrates from pneumonia. His oxygen saturations were in the 70s. It should normally be in the 90s. He couldn't work and he wanted to get married. He had a fiance. I gave him the ivermectin glutathione protocol, and 2 weeks later, he sent me his x-rays and let me know he was completely well. X-rays had cleared, back to work, and he's been fine ever since. Now, they're anecdotal stories, but I have had enough people at this point who've been severely ill, including a 75-year-old woman with chronic hepatitis going downhill after 3 weeks, took the ivermectin, and this protocol completely turned around. People in my office who got sick, very ill, within days of taking this protocol, reversed. So I know it's working, but we are going to need a randomized trial to prove it to the world.
I know. That's the sad part of it all, is that we don't have that freedom of choice, or informed choice to say, okay, well, even though there's not a trial here, you've had so many success, and none of your patients, as I understand, have gone into a ventilator or have to go to the doctor or the hospital. So, that's
none of my patients who've taken this protocol event. The thing about ivermectin, it's really interesting watching the medical politics. When I published my second study back in 2020 in COVID, it was in a journal called Medical Hypothesis, and I was discussing 3 urgent things that needed to be done regarding diagnostics, therapeutics, and prevention. One of them was actually about using ivermectin for prevention. Well, since I published the study, they have now a study on healthcare workers who took ivermectin pulsed like once a week, twice a week. They never got ill. I take ivermectin once a week, 0.2 milligrams per kilo, along with 750 of glutathione twice a day, 600 of NAC twice a day. You can, again, go on my website, cangetbetter.com, just look at the protocol.
Yep.
Now, so when I published the study, I was looking at initial studies in ivermectin, lowering the viral load by 5,000 fold in 72 hours, great antiviral effects against influenza, hepatitis, HIV, dengue fever. In other words, the drug had already been proven to have very good antiviral effects way before COVID ever came out. So it looked to me like this was going to be a winner in the race. Well, a year later, there's over 26 studies, 10 of them randomized trials showing benefit, yet the FDA has not come out and approved ivermectin. And my concern is it's from medical politics, because this is a drug that is safe, it is effective, it's been out for decades, it's a WHO essential medicine, and there is no reason in the world with this many randomized trials that the FDA should not be approving this. But I'm not on the FDA board. I'm not sure what they're thinking, but if they come out and approve the Merck drug, because Merck made ivermectin, and they do this without long-term safety studies, you will be seeing a lot of posts on Facebook and maybe op-eds I will be writing regarding this, because that would just be a crying shame that medical politics have gone to that level where you could be saving people's lives and decreasing morbidity and mortality, and you're playing games because of your associations with drug companies.
There's so much I want to say right now that if we were on BitChute, I would say it. But there's so much I want to say right now. And I want people to hear between the breath, just hear between the words, more than just the breath. There's so much more going on here, and we just need to wake up to the withholding of information. To me, is control and manipulation. So let's go back, because when we first did our class together in May, for which turned out to be a wonderful blessing to everybody who heard this, because you have been speaking about this even back then. I was shocked to hear we were going to do a Lyme's class on in the classroom, and it turned out to be totally on COVID. And at the time, I remember every time you'd say something, you'd say totally anecdotal. This is what my patients have been going through, and we don't know enough. Well, now we know a lot more 10 months later. If you were to look back at that class and say, we don't know what we don't know, like one of the things that you had mentioned was asymptomatic, because that was a way to get people even more scared that even if you were healthy, you were still contagious or potentially contagious. What have you learned from that since?
Well, so the asymptomatic carriers are a problem, and it's especially in the younger population where some of these people do not get sick, but they carry the virus. Now, the problem right now with the vaccines is we don't know that the vaccines is going to stop transmission. When you get, for example, a Pfizer or Moderna vaccine, and I'll get into the differences, by the way, in the show later on between the Johnson & Johnson and these, your body creates IgM and IgG antibodies, which are the standard antibodies you use for early and late infection. But what you don't produce is IgA antibodies. IgA antibodies are the body's first mechanism of defense when you get a pathogen that gets into your body, whether it's through the upper respiratory tract and the nasal passages, or whether it's through the gut. So we don't really know, even when you have antibodies against COVID, it is not clear that you still could be transmitting the virus, especially the new viral variants that are now emerging. There's the Brazilian variant, the New York strain just came out. There's a Southern California strain. The UK seems to be the one that most people are concerned about. But we don't really have enough information that the vaccines are going to stop transmission. So, we're releasing mask mandates at this point and social distancing. And the CDC is saying, if you've had your vaccinations, you can get together. I understand people are tired, but I will tell you that this virus is still mutating. And it's a little early, in my opinion, to let down the guard. We're all tired from it. I got it. But we don't know about the transmission at this point, nor do we know enough about the variants because they just keep changing.
Okay, so with a survival rate of 99.98, can we put it into perspective? How serious is this? I know that the virus is out there. There are trillions of viruses out in the world. I mean, is this something that, that we're maybe much to do about nothing? Are we overly scaring people about a virus that you have a pretty good success rate of recuperating from completely?
No, I don't think we're frightening people for an unnecessary reason. I mean, the mortality rates early on, when you look at the early studies from Italy, it was like 12, 13%. By the time I was publishing my articles last year, about a year ago, it was around 5 to 6% mortality worldwide. Well, as time's gone on, the mortality rates have gone closer to about 1%. And clearly it's in the highest risk categories. If you happen to be over 65, 75, and you have high blood pressure and diabetes and you're immunosuppressed, and you happen to be Hispanic or African-American or Native American, who that whole population has gotten decimated by COVID, where the rates are much higher in the minority populations. And that's because basically they have underlying inflammation that's going on in these populations that has not been adequately addressed. So I think you've got to be on guard and you have to pay attention to this, because even kids in their 20s and 30s have died from COVID. The rates are much lower, but there are 27-year-old, young women who've gone into the hospital and died basically because they had risk factors. Now, I'm not personally worried about getting the virus and dying from it. I believe I have a healthy immune system, taking a lot of things to protect myself. But depending on your risk factor situation, And depending on how much you're taking every day to lower inflammation and balance your immunity, I take beta glucan. I've been on beta glucan for 15 years, primarily to stop cancer because my family history of cancer is so horrible. But beta glucan also raises natural killer cells and T cells, which are the cells you need to be able to fight the virus. I've been on broccoli seed extract, curcumin, NAC glut for probably 2 decades at this point. So I've been protecting myself. I don't think I have a lot of risk myself, but I just hit 65 years old. I've had a history of asthma. It's controlled if I don't eat a lot of dairy and chocolate, my allergic foods. But I'm not going to run around exposing myself. I mean, the
No,
virus can be dangerous.
of course, of course.
But I don't think we need to. I don't think fear is the proper response. The proper response is, yes, we need to pay attention. Masks have helped, by the way. I mean, CDC earlier was asking for double masking. Now they're saying if you're vaccinated, take it off. Let's watch how this plays out because of the variants, and
Well,
because
but
we don't know if the vaccines are going to keep down transmission.
But they've already said in the when we read about the vaccines that the vaccines don't necessarily stop the virus, but that they will lower your symptoms or reduce your symptoms if you get it. So why vaccinate when eventually, if everybody gets it, we will build herd immunity, or we will be, now what God does naturally, and it'll go away.
Well, the problem with it is that to build up herd immunity, I mean, we've had over 500,000 deaths in the United States.
But are they, but are they COVID? Because I
Well,
know that
it's a whole separate issue.
Oh, okay,
Um,
okay.
It is difficult to know. It is because people that have died, for example, when you look at the vaccine studies, there were people in Europe, 75, 85 years old in the Scandinavian countries who died within 2 weeks of the vaccine. And they said, well, they were 75, 85, they died. We don't know if this is, due to the vaccines. Well, yes. And on the other hand, it's not necessarily coincidental. So it's a little bit tough to evaluate. But when you look at the vaccine rates of keeping down death, just that alone, the vaccines are working. Now, that's very clear from the data. We have over 90 million doses at this point of Pfizer, Moderna. The death rates are definitely down. Does that mean you still can't get sick from it? No, you absolutely can. But I think, the unknowns from the vaccines is, I think, what's worrying people at this point. But what I would say on it is, yes, it's new technology. And yes, we're not going to know until years from now if there are side effects from these vaccines. But the reason I don't think it's unreasonable for those with risk factors to do the Moderna Pfizer is the messenger RNA, when they are putting it into your body, it's destroyed within minutes. The viral vectored vaccines by Johnson & Johnson and AstraZeneca, and by the way, just a day or two ago, they stopped the AstraZeneca vaccine in Denmark because they were finding that people were dying from immune events with low platelet counts, which is what they saw in a handful of people in the US. So they're holding the trial now for 2 weeks. But the difference with the AstraZeneca and J&J, it's an adenovirus vaccine. It's the first time it's ever been tried on civilians. It's only been used in the military. It was not highly successful for anthrax or for HIV. The place where they were making it before, they were kind of dusting it off because they hadn't made it in decades. And there's no experience with this. And they're putting DNA into your nucleus, telling your body to keep making spike proteins. What could happen is an overstimulated immune system months or years down the line when you're exposed to another coronavirus, because eventually these will be like flu viruses. They're not going to be as deadly as they are now. And then we just won't know whether a certain subpopulation who gets exposed after getting these vaccines, where they went into the genome, you may find that you actually get sick. But at this point, the problem is there's so many unknowns. The best you can say is the Pfizer, Moderna keeping down death rates, messenger RNA destroyed within minutes, not unreasonable considering that the anaphylactic rates are, 40, 50. There's been about 40, 50 autoimmune events. It's been known with MMR vaccines, hepatitis, influenza, these can happen. But out of 90 to 95 million doses, you're still talking a handful of these and keeping down death rates. So, we'd all drive cars, we all get on planes, we all have risk benefit. Personally, I don't think it's unreasonable for a risk to do those vaccines, but I would absolutely not take the J&J and the AstraZeneca. I don't like the technology that they're using, and I don't like the fact that they have stem cells, which they have used in cancer cell lines to grow these viruses, where you're then introducing stem cells into the genome of your body, into your DNA that have been modified. Nobody knows what that is going to do years from now. So when people think these vaccines are all equivalent, they're not equivalent. The messenger RNA vaccine is very different than the DNA vaccines, which are the adenovirus vaccines by AstraZeneca and J&J.
Okay, there's so much that you said here that I want to discuss, but I want to encourage all of you because I listen, the algorithms are being garbled up. I want to encourage all of you, take your phones right now, invite a friend, tell them to come listen because the numbers, even the numbers are being garbled. So there might be 100,000 people watching today, but we don't know what we don't know. So I need for you to do your part. Please tell them that Dr. Richard Horowitz is in the classroom and we need to learn what he has to say. So I want to go back because you cannot say that your protocol is anything but anecdotal because you haven't researched it. You haven't done a trial.
I've not done a randomized
trial. Okay, so I misspoke. A randomized trial. But then the people from the vaccine industry can say that they've lowered death rates when perhaps maybe the death rate would have been lowered because many of the people who passed away from COVID were on ventilators and the ventilators may have killed them versus the COVID killing them. So there's a lot of, I would call that anecdotal. I in my head, and correct me if I'm wrong, that saying that the vaccine have lowered the death rate is anecdotal to me, because is there a study saying that that nature hasn't taken care of this virus?
No, I don't think the statistics are anecdotal because it's 95 million doses and they're tracking the death rates very, very carefully. No, I think it is keeping down death. I don't have any question about it. You know, the issue with vaccines, and you've always got the people on one side or the other, but, you know, I've personally, I mean, I don't get the flu vaccine every year. The flu virus mutates and the vaccines are usually 30 to 50% effective. If I were to get the flu, which has only happened to me once, I take 5 days of Tamiflu, high dose glutathione, which has been effective in influenza, glutathione to take the inflammatory cytokines out. I mean, I've figured this thing out, but you have to realize that not everybody knows my protocols. So worldwide, a lot of people are not going to find out about ivermectin glutathione. They are going to need ways to protect themselves. And the people on the ventilators, right, that have died, I mean, we learned early on, you should not be using these kind of positive PEEPs, these high pressures. That's what they were doing before they realized these people were throwing clots and having pulmonary emboli. I mean, this was early on when we didn't realize what was happening exactly. And that's what they're now seeing with the AstraZeneca in Denmark, that there were clots being formed and probably what they call ITP, idiopathic thrombocytopenic purpura, which was a potential side effect of vaccines. But it's, you know, it's a fine line because vaccines have saved lives. There's no doubt, but vaccines have side effects. So the problem with the media is it's all black and white. It's saving lives and there's never side effects. Absolutely not. But everything in life is risk benefit. Now, I'm following the data very carefully. It has been keeping down deaths at this point, but I am concerned about antibody dependent enhancement, that you may have an overstimulated immune system, specifically with the J&J and AstraZeneca, because they're giving your genome of your body, your DNA instructions to make these spike proteins for long periods. And that's what they found in old studies on adenovirus, that some of these people had overstimulated immune systems. So all of these viral, experimental vaccines are exactly that. They are experimental. It's just, if they would have invested not just $18 billion in vaccines and $6 billion in antivirals, right? A 3-to-1 ratio. Now they're trying to play catch up with antivirals, and they're only looking at ones by major drug companies like Merck's new drug, remdesivir, right? Nobody wants to look at hydroxychloroquine, which, by the way, recently French researchers did show some efficacy. There's been like so many negative studies. Now there's positive studies. It's like, welcome to the world of medicine, where politics plays a role. And you just have to go through this data slowly yourself to figure out what is truth and what's not truth.
Okay, so right before you came into the classroom back in May, because you also did another class in September, that we talked about the updates and what we need to know about getting better. And we talked about how I Can Get Better, the book, and the 16 steps that you can check off, how to get better. There was a trial that claimed that hydroxychloroquine was killing people. They went into this study, they went back, and the doctors were looking at it going, how could this have killed so many people? And it turned out that they were giving 3 times as much the legal dose to these patients. I personally, if I would have seen something like that, we know that people are prescribed, there's allotted prescription at the higher end and the lower end, but they were giving 3 times as much. And of course, those were the studies that they published on hydroxychloroquine. What would you say about that? I mean, there's a lot of science out there, but now science has been corrupt. It's been corrupted to prove a point or scare people towards one drug or another.
Yeah, I mean, I don't think it's all corrupt, but if you're asking me, do medical politics play a role of what appears in the journals? Yes. I mean, JAMA just published an article that 5 days of ivermectin doesn't work for mild disease. But if you actually look at the statistics and how they analyzed it, it was a very poorly done study. But if you look at JAMA in the New England Journal, you're only going to get major drug companies sponsoring. The Lancet, on the other hand, and some of the international journals, they're not quite as biased, but they did reverse what they found on hydroxychloroquine. It did not kill more people. I've been using hydroxychloroquine with macrolides for 30 years in 13,000 people. Nobody's died from using that protocol. It's only if you had QT prolongations on your electrocardiogram, meaning on your EKG in your heart, you had an electrical disturbance, then certain things can happen. But truthfully, no. They basically retracted that. But this was kind of the ping pong match of what I believe is happening, of the major drug companies slamming down generic drugs and trying to put forth their own. And any consumer out there just needs to know, you got to go through the studies carefully. And the average consumer is not going to have the scientific background to do that. But, I'm doing it on a regular basis. And you're correct. They made mistakes on what they did with hydroxychloroquine. The latest study out of France showed, in fact, that when they analyzed all the studies, there was some benefit, but God forbid you should touch it at this point, because politically it's unfavorable, right?
Yeah. And, and I don't even know if I should go there right now with this, but I've learned, and that Dr. Judy Mikovits has been in the classroom, and we've learned that some of the vaccines, or perhaps maybe all of the vaccines, I can't claim that, I haven't researched all the vaccines, but they have animal viruses in there. She calls them retroviruses that are healthy in the animal when they're testing and they're doing the whatever as they do to make their bats of vaccines. But some of these viruses are harmful to people, and they lie dormant in our body because the people that are getting vaccines, the people that are taking certain drugs, it activates when something is happening in your body. We talked about exosomes. We talked about, how the body naturally tries to fight all this. But when we have these viruses that are dormant in our body that we don't even know where they came from. And some say that it's from these vaccines that we're being injected upon. So when one of the things that you said was that one of the symptoms are a sense of smell and taste, that it goes away. You're losing your taste. And that is also something that happens with neurodegenerative diseases like Parkinson's, Alzheimer's. And you had mentioned babesia. And so with babesia and Lyme disease, some people have said that Lyme disease has been something that was created as they have said that the coronavirus was created in a lab. Have you done any research on that? Am I saying the question well enough for you to understand?
Well, you're questioning whether it was, made in basically on Plum Island and bioengineered, and the answer is Congressman Chris Smith in Congress actually has asked for an investigation into that. But if you're asking the question, was it a newly created bug? The answer is absolutely not. Lyme has been around for over 1 million years. Babesia has been around for millions of years. They find it actually in amber if you go into amber and you look at the DNA that has been preserved in amber from millions of years ago, they've actually found these bacteria and these parasites. They're not new. Whether they have been manipulated, that's a whole nother story.
Okay, so that's what I'm talking about.
Yeah. So, I mean, I can't personally answer that. If you're asking me, do I think governments worldwide do bioengineering experiments? Of course they do. I don't think anybody's going to deny that one. The question just is, did they do it here? To what extent? When did they stop? Because during the Nixon administration, they basically were told to stop. But it's tough digging it up. But Congressman Smith is actually looking at it. Now, what's more difficult with the coronavirus is, have we been doing experiments on coronaviruses and bat viruses in the United States and working with the Wuhan lab? The answer is yes. Did it get out? Nobody's admitting it. Do I find it suspicious? Yes, I do. Can I prove it? Absolutely not. And it's one of these political things. Don't go there. Oh my God. But if you speak to researchers, antiviral researchers, HIV researchers, Luc Montagnier, in other words, they've analyzed the virus and they found that there are HIV parts of the virus in the coronavirus that look like they were inserted, that are not normal. Now, I'm not a virologist. I can't comment on it. All I can say is Luc Montagnier is a really bright researcher. He's not the only one that found it. Do I think they played around with these? We know they have. The question is, did it really go from a bat to a pangolin, in a market in Wuhan and end up in humans? I mean, that's the issue versus it got out by accident. You can't answer this stuff right now, but have we played around with these things? We have. If you go back to the government patents, there are government patents on looking at making vaccines against these things going back before the coronavirus pandemic ever happened.
Yes. And I've researched all that. I can confirm that that is absolutely true. I've posted this on my blog where I've sent all the patents to everybody who wants to look at it. It's out there. The coronavirus has a patent. HIV has a patent, Ebola, Zika, they all have patents, and you cannot patent anything that's naturally occurring. And so anyway, I'm not going to go down that path, but I just want to encourage all of you to do your homework. Again, Dr. Richard Horowitz has several books. One of his, Why Can't I Get Better and How Can I Get Better? And it has 16 points. 16 things that you need to look at, and it tells you how to test it. And so the first time I ever heard be your own MD, be your own medical detective, it was from Dr. Richard Horowitz. So if you ever hear me say it, I usually quote Dr. Horowitz, and I say, I learned this from Dr. Horowitz because it was life-changing to hear that I can be my own MD, and so can you. So I want to encourage you to get this book. How can I get better? I also want you to go to whenyouneedafriend.com. Please check out my website because, as I said, we don't know what's going to happen after this class goes public. And you can always, we're going to upload this on BitChute as well. So if you want to share the information, you can share it on Facebook, YouTube. You can also go to BitChute, podcast. All this information is for you to use and educate yourself. And go to whenyouneedafriend.com. Please subscribe, because if you no longer find me on these wonderful platforms that I absolutely love and I'm grateful for, then you'll know to find me at whenyouneedafriend.com. While you're there, please subscribe, follow, like, and especially BitChute. I want to grow that channel much bigger than we are right now here. And so also check out my sponsors, because without my sponsors, there would not be a class that you can attend for free. Where can you go for free if you don't have sponsors that are helping with the production and the cost? Then we wouldn't be able to do this or continue to give this information to you when the mainstream media is not having these conversations. And so I want to encourage you to go to my sponsors page and check out Keep Me Safe Organics. They're beauty products. They're all organic. I use it from head to toe. There's First Alternative Care, telemedicine, the pharmacy in Merritt Island. Mention my name and you get discounts on this. Geyer Wellness Group, Right Way Health and Wellness. We have, and Dr. I don't know if Dr. Horowitz knows Dr. Jennifer Gramuth, but she studied with Dr. Lee Cowden as well, the lymphatic system. And so she's out there sharing on how you can heal from the balancing your lymphatic system and getting healthy. And we have affiliates like Ground Therapy, Brain Tap, Avasia. These are all things that are for you to take your life back and health back without having to take a pill. And of course, B3 Sciences, I'm not going to show you my muscles now, but B3 Sciences, that's blood restriction flow bands that are just unbelievable. So check them out, go to my affiliate site and help the sponsors, whatever they're doing, help them grow, support them as they're supporting the classroom. And finally, you can become a enrolled student in the classroom by donating, whether it's $1 or $1,000 a month, either your time, your talent, your treasure, whatever you can to help us grow the class. By you sharing and tagging and getting this information out, you're also helping grow the class. And Dr. Richard Horowitz, you can find him at cangetbetter.com. He's got this, and then you go onto his website and check out how you can get better from COVID or prevent it. Now, Dr. Horowitz, I am always so grateful to the information. Every time you come into the classroom, you are so generous giving information. One of my takeaways from this whole year that, that made me go into this rabbit hole and take another red pill. I noticed that this is like a second chance for all of us. Because I noticed that people like me, people like you, we're healthy people. If we might even know that we got coronavirus, we might be no symptoms whatsoever, gone in, gone out. But that this is really a second chance for us to start looking at our health again, so that if anything happens like this in the future, we know that we are healthy, our body will act accordingly, right? And so would you like to say anything about that?
No, absolutely. And the reason you need to take care of your body and protect, because even if you get a mild case of COVID and you get over it, what they're showing is weeks down the line, 30-40% of these people are going on to become long haulers, or what they're now calling PASC, post-acute sequelae of COVID, which means you may not recover your sense of smell or taste. There's chronic fatigue. Some people have chest pain, shortness of breath, chest tightness. Now, we are presently looking at ivermectin and high-dose glutathione. It has helped a couple of these people with long COVID, and we're actually looking for people who to enroll in our practice who have not gotten help from their private doctors. They can contact our medical office in Hyde Park, medical@hvhac.com, if they need consultations for it. We're not looking actually for business, but what I am looking for is to treat 50 or 100 long haulers with this protocol, so I can get a sense how well it's working and then publish it in the literature. So far, so good. But you want to take care of yourself and make sure you have adequate antioxidants and that your immune system's working properly. Because again, even if you get over COVID, it doesn't mean you may not become a long hauler, and they're examining the causes of it. Personally, I would like to see the 16-point MSIDS model applied, because a lot of these people do not have adequate antioxidants to protect them against the free radical oxidative stress. So they may be getting mitochondrial dysfunction. We know that just like in Lyme, they get something called POTS, postural orthostatic tachycardia syndrome. Yeah. Same thing is showing up in COVID from autonomic dysfunction from the inflammation, where they're getting dizzy, they're standing up, they get tired. So POTS is in Lyme, POTS is in COVID. We're seeing a lot of overlaps between the two. And at this point, you want to protect yourself and make sure your immune system and basically your antioxidant defenses are able to keep up with what happens with the virus.
Yeah, there's so much we don't know. And the most important is, and one of the things that Judy Mikovits said in the classroom was that when you're healthy, your body won't respond to the virus the way that some people respond when they're not healthy. The body takes care of it, puts it away, and you had mentioned glutathione. And when people are low in glutathione, these are the people that are having prolonged illnesses, or what did you call it? It's the long hauler.
They used to call it long COVID, long haulers. Now the new name for it is PASC, post-acute sequelae of COVID. But yeah, so I mean, some of these people, they're actually predicting it's going to be millions and millions of people, because up to at least 40%, that's the number I've been seeing, 30 to 40%, go on to get chronic illness, and that could be despite not having a bad case of COVID. So I think, if you can keep yourself healthy early on, it'll help. And by the way, regarding the retroviruses, it is true that we have them, but I'm more worried about the retroviruses if you were to get the J&J, the AstraZeneca, because then you're introducing DNA into your genome. The messenger RNA by nature is destroyed within minutes. Now, I'm not sure the retrovirus can grab hold of that enough to retransform it into DNA. Again, these are unknowns that no one knows, but my best bet is it's not going to be quite as common or at all based on the early studies that I have seen. When I've done literature searches on messenger RNA, literally it's in and out of your body within minutes. The problem for some people is the PEG, the polyethylene glycol, which is the lipid layer they're using to get it into your cells. And because it's a lipid, theoretically, if you were to take some high dose glutathione several hours after a vaccine, you should be able to be pulling some of the PEG out of your body. That's, I think, what I've been recommending to some of my patients.
And what is that test that you can take to find out if you have a low glutathione?
Oh, this is a blood test. You can go to LabCorp Quest. They will check glutathione levels in the blood, and they are showing, ever since I published that first study on glutathione a year ago, they have now shown low glutathione levels in people in the ICU who are getting COVID. So, I mean, there's not even a doubt that this is showing up. It's just we don't have the opposite side of the equation. You have low glutathione, let's supplement it. And lo and behold, does this prevent the worst complications? This is why I'm praying that this randomized trial get done.
Yes, yes. And so I want to encourage all of you to go check out what Dr. Richard Horowitz was doing back in May, before any doctor was talking about glutathione, before anyone was talking about anything like with COVID, he was doing it. So, and it's interesting that it's gotten stronger. You've gotten stronger and stronger with your studies and research, and you're still doing well in New York, which was really high affected area. And so again, I'm not going to go into the reasons why and all of that, but I do want to go back to your specialty, which is Lyme's. And for people who don't know, Dr. Horowitz has published many studies that he's done, and I'm so happy. Every time I get an email from you letting me know what your publications have been, it's been wonderful. Is there anything that you would like to update people that have, because you even said that OCD is a sign of people that have Lyme's disease?
Yeah. So, I mean, the problem with Lyme is it's known as the great imitator. So you could have been diagnosed with chronic fatigue syndrome, fibromyalgia, which have exactly the same symptoms of Lyme, MS, rheumatoid arthritis, there's overlaps with Lyme, early dementia, there's overlaps with Lyme. It's the great imitator. So you have to be careful, because even neuropsychiatric problems, depression, anxiety, OCD, schizophrenia, they can all come from Lyme and or co-infections like Bartonella. So, you know, if all of a sudden you're healthy and you suddenly get sick and you have a neuropsychiatric problem like this with chronic fatigue and a musculoskeletal illness, and the hallmark of Lyme is the muscle, joint, and nerve pain move around the body. They migrate. That's only seen in 7 other diseases, and none of them cause migratory nerve pain. Yeah. So yes, you've got to differentiate, in fact, these days, Lyme from COVID, because the symptoms overlap. I mean, the loss of smell and taste that you said early on, that's specific for viruses and COVID. But otherwise, if you look at the symptoms, there's a big overlap of Lyme and tick-borne. Lyme doesn't cause the same respiratory complications. Babesia can, relapsing fever can. So that's a bit different, but the symptoms overlap. You need to do a differential diagnosis. And for anyone who wants updates on like what I'm doing with Lyme or COVID or the climate, because I will have a new book coming out, a novel that was just accepted by one of the publishers. It should be out at the end of the year, because I think the climate crisis is probably the biggest existential crisis we faced. My Facebook, Dr. Richard Horowitz, Dr. Dr. Richard Horowitz. Every day I'm posting updates on Lyme, co-infections, the climate, and COVID. I mean, those are the 3 topics that I think are the most relevant at this point for trying to help people through like what are the biggest challenges we now all face.
Absolutely. And I'm hoping that this is the worst it gets, and hopefully it'll be smooth sailing from the future on. But some of my research shows me that, you know, history keeps repeating itself. Every 2 years, the history keeps repeating itself. And so I want to encourage all of you, if you're listening on podcast, just know that we have a Teacher's Pet Corner, and we're going to answer your questions after the class today. And so you can feel free to join us. The book is called How Can I Get Better and Why Can I Get Better? Those are the 2 books. And if you find yourself going, gosh, I asked myself that question too, it's time to become your own MD, like Dr. Richard Horowitz says, and get your own health back. Dr. Horowitz, thank you so much for everything that you do. I love your honesty and your logic as well. So thank you for everything that you do. And I'm already looking for our next conversation.
Thank you, Lillian. And to you and everyone else, have the best day.
Not
ever.
yet. Oh,
not
please
yet.
remember,
Oh, God, it's too early.
we'll be right here waiting for you worldwide
Okay.
at whenyouneedafriend.com. This is Lillian McDermott and Dr. Richard Horowitz wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. That was great. I love it.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
Okay, Dr. Horowitz, we have some questions from Catherine. She wants to know, if I want a supplement with glutathione at home, what doses are you recommending?
So it depends on age and body weight. I'm 155 pounds, but I hit 65. So early on, I was taking 500 milligrams of glutathione twice a day. Now, it's again anecdotal. I've had patients who have taken up to 750 twice a day, 1,500. 7 out of 8 people got COVID. This is early on in the pandemic. And this person who took that, they didn't. Now, NAC and glutathione both have antiviral properties. They've been shown that these groups that are sulfa groups, they're called thiols. These groups may actually bind to the virus and stop it from binding to your ACE2 receptor, slowing the viral entry into the cell. Similarly, if the virus gets into the cell, the only way the virus turns on is through oxidative stress from inflammation. Glutathione and NAC shut it down. So minimum for me, 250 of glutathione twice a day, average 500 twice a day. If you happen to be someone with a lot of risk factors, probably 750 twice a day, with NAC 600 twice a day. Those would be the recommended dosage.
So someone like me that's healthy, I just after your class that we did, I've been doing IVs with glutathione, and boy, it hurts when it went up my arm. It hurt. It gave me a pain. I knew exactly where it was in my body. Is that normal or?
No, it actually isn't. I'm wondering if they put it in the wrong place, because normally you're not supposed to have any pain whatsoever injecting glut. You just have to inject it slowly.
I think that's what he did. I think he injected it too fast.
I mean, that may have been the issue.
Yeah. Okay, so then the next question I have here, let's see. For those of you who have any questions, type in the queue. Would you please show the book again and on the steps? Okay, so the book is How Can I Get Better? There we go. And you can get it at Amazon. Where else can you get it, Dr. Horowitz?
Oh, and any of the sites, barsandnoble.com. I mean, obviously people are not going into bookstores as much, but by the end of this year, that will change. But yeah, it's all of the major book distributors online have it.
Yeah, and there's the 16 steps. And can you explain a little bit about the 16 steps, Dr. Horowitz?
So in searching for answers for these, thousands and thousands of chronically ill patients, I was looking to find the common denominators that would explain why they're ill. So what this represents, the 16-point model called MSIDS, Multiple Systemic Infectious Disease Syndrome, is a model I developed, and it's applicable, by the way, to all diseases. If you have diabetes, strokes, Parkinson, Alzheimer's, it doesn't really matter what you call it. Instead of just naming a disease in medicine, which is what medicine does, and then throws a drug at it, the smarter approach is to figure out, well, what are the underlying potential etiologies, not one cause, but multifactorial, that may be causing it. So what we discovered in the model, there's multiple causes of inflammation that can make you sick. So one of them causes infections. Lyme is bacteria, but it could be viral, parasitic, candida, fungus, mold. But we also found that leaky gut and food allergies will cause the same symptoms as Lyme with inflammation. Or let's say the microbiome of your gut doesn't have the right bacteria. You've got the wrong Prevotella species or Bacteroides, et cetera. Well, that can cause inflammation. They've linked it up with autoimmune Parkinson, Alzheimer's at this point. Mm-hmm. And let's say you're zinc deficient, you're mineral deficient, which you need for inflammation. That can drive inflammation. You're not sleeping, which happens to Lyme patients all the time. That drives inflammation. So inflammation is the number one common denominator in all chronic disease and acute diseases. So whether you call it psoriasis, asthma, strokes, heart attacks, Parkinson's, Lyme, COVID, inflammation is the number one common denominator. But you can have inflammation coming from multiple sources. And that's what the MSIDS model addresses, while also addressing the downstream effects of the inflammation. So what happens when you get an inflammation, your pituitary, the main part of your body that controls hormones, in some people, it shuts it down. So men get low testosterone in their 20s. Women can go into early menopause. People have low adrenal function, which you need to have stamina and energy. It can affect the mitochondria, the parts of your cells that make energy, because they're not protected from free radicals and oxidative stress. So what this model does is it says, well, there are multiple causes of where the inflammation's coming from, multiple downstream effects, including POTS dysautonomia, now being seen frequently, by the way, in COVID. It just tells us, hey, here's a comprehensive model. No matter what's going on, you may want to apply this, because I've had patients come to me saying, hey, doc, I got early dementia. And I put them on, I checked their Lyme testing and it showed they had it exposed. And I put them on like really low doses of medicines, like 50 milligrams of minocycline with 25 milligrams of dapsone. These are like homeopathic doses of these medicines. And the patient would come back a month later and go, oh my God, my memory's completely well. I feel great. And how many people go on and think, oh, it's early dementia? They get worse instead of thinking there may be reversible causes like tick-borne or heavy metals or pesticides. And that's the point of the book. It discussed not only Lyme, but many of these other diseases and certain etiologies that people need to look at.
Yes, yes. And of course, you've got lots of studies. You've got the double dose dapsone therapy that has changed so many people and given them their life back. You've done incredible. So I want all of you to check this out. The book is available to you. If you can't afford the book, my goodness, just go to the library. There's no excuses to take your health back. Okay, so we have another question, and it's, what is your opinion on experimental BAM antibody infusion? I don't know what BAM is. What is BAM?
The truth is I'm not sure either. I know people have used exosome therapies for Lyme with variable results. People have used stem cells, very variable results. But BAM, maybe they could explain what it is.
Yep. If you're still watching, can you please explain what that is? Okay, so let's see. There's another question here. Andrea says that she got Guillain-Barré syndrome from a vaccine. Can you share a little bit about that, Dr. Horowitz?
So Guillain-Barré syndrome is where you get an ascending paralysis, and it's a well-known side effect of vaccines. They've seen it in MMR influenza. It happens to be a side effect of vaccines. Fortunately, rare, but does it happen from vaccines? And can you see an increase from the general population? Absolutely, not even a doubt about it. It's unfortunate. It's kind of an autoimmune phenomenon that happens to some people after they've gotten vaccinated. Now, personally, in my practice, I've been doing medicine for 35 years, and I've never seen it happen. But if you've asked me, have I, seen vaccine injuries in rare cases from influenza shots and otherwise, where people got like polyneuropathy and inflammation, it can happen. It's rare, but it is definitely a potential side effect.
Okay, so here's a question from Sherry. She says, does Dr. Horowitz recommend the vaccine for someone battling multiple tick-borne infections and the flares that go with that?
So initially early on, I was not recommending any of them. As time went on and I followed the Moderna and the Pfizer, I have been recommending them at this point to my patients, mainly because the statistical studies is it keeps down death. And I can't predict the future, whether there will be side effects. But my Lyme patients so far, not one of them has had an adverse reaction so far to the vaccines. In fact, this is really interesting. There was one patient who actually got better with all of her Lyme symptoms, probably because she needed a little bit of an immune boost after she got the vaccine. But I have not seen any problems so far with it. Now, it will, of course, depend years later whether this thing called antibody-dependent enhancement happens from it. But right now, keeping down death, I mean, look, do I have confidence in ivermectin and glutathione? Yes. But the problem is it's not going to be available to every person out there. And when I'm posting on Facebook and I'm telling people to do this, I have to realize that you may not have healthcare practitioners that will prescribe ivermectin to you. So I've got to do what I think is best for the general populace. And I think at this point, when I've looked at the efficacy rates, keeping down death and hospitalization versus autoimmune reactions, anaphylaxis, the rates are really low. And in fact, they're lower compared to most vaccinations. And the thing I like about these vaccines, there's no heavy metals. There's no mercury thimerosal, right? There's no aluminum, which they use as an adjuvant in many of these vaccines, which have been associated in the pediatric population with certain autoimmune events. It doesn't exist in the Pfizer Moderna. So, could there be other problems down the road? Yes. But right now, my Lyme patients are tolerating them perfectly.
Yeah.
They have not had herxes. Everyone seems to be doing well with them so far.
Yeah, I just, I'm not giving my opinion other than for myself. I've not read that these vaccines, Pfizer's vaccines, the Moderna vaccine, that they claim that they prevent from getting COVID. They just reduce your symptoms.
Correct. No,
So-
it's more reducing hospitalization and death, not necessarily not getting it. And like preventing transmission, we just don't know. It seems like from the early studies, it may be, but we don't have enough information. But the death rates, it is quite clear at this point that they are reducing deaths. So,
But the death rates have been reduced simply because their treatment have improved, that they're not killing people with ventilators, that they're not, so I don't know. I mean, how can they study that people aren't dying from this when they don't have enough studies to claim that? They don't.
Well, see, the problem is I don't actually think we have any great published antiviral at this point. I mean, the monoclonal antibodies that have come out, they only are going to work with COVID as it is now. As the variants happen, the monoclonal antibodies are not going to work because it's a different virus.
Mhm.
So you're going to see right now when they're looking at remdesivir, monoclonal antibodies, dexamethasone. Dexamethasone is the only one in ventilators that is actually shown by lowering inflammation. It's lowered mortality rates. But truth is, there's nothing that's been published. I mean, my take on it, if I was running the government and head of HHS, I would have done this ivermectin glutathione nutraceutical study early on, because you need an antiviral. You can't just rely on vaccines. And that's the bias of our government and the way the healthcare system works.
Well, with vaccines, they have no liability. With medications, they have liability. So they're probably, I mean, if I had a business that I was allowed to do things without any liability, I don't know if my quality control or would be as high as it would be as if I were penalized if something happened because of my negligence. So
the only thing I can say here about it, though, is because there's been so many people that have been worried about these vaccines because they're new technology, they have been forced to follow this an awful lot closer. Most vaccine studies, they only go out like a few weeks to a month. Right now, they're following people long term. And that has not, by the way, generally happened with vaccines because they made the assumption they're safe. Incorrectly, I believe, because there are always side effects of whatever medical intervention. So look, I mean, I think it's going to play out over time, but everything in life is risk benefit. And the death rates are still around 1%, from this virus. We're over 500,000 deaths. Personally, I think anything as a physician that's keeping down death rates, knowing we have unknowns, you still got to weigh it out at this point if you're somebody who has cardiac and other risk factors that put you at risk.
Absolutely. Ultimately, it's your choice. It's the person's choice. Now, Catherine says that BAM is now used to treat COVID. So unless you tell us what BAM stands for, I don't know if Dr. Horowitz will be able to answer your question. What does BAM stand for? But Dr. COVID, Dr. Horowitz, it's always wonderful. I love getting your objective. You are so good about sharing this information, and it's just, you use logic, you use science, and I love how you do that. Okay, let me see if there's anything else. Yep, I think that's it for now. Dr. Horowitz, I am looking forward to our next conversation. I think it's wonderful that you are doing such great work, and I do hope that your study will move forward. Any word on that happening anytime soon?
I will text you or send you an email if I hear back. I'm hoping they told me at the university they want this to happen. I find it really a crying shame that you're talking about money at this point with trillions of dollars, and not that I'm saying $1 million is not a lot, but I don't even know that this actually even costs $1 million. It's a 14-day study with generic drugs. I got Zymogen, who's making the packets of these nutraceuticals. It's $10,000 is what they're charging. The people who are making liposomal glutathione from Birmingham, Alabama, where we've gotten it from, they're charging $8,000. So the actual cost of ivermectin and the nutraceuticals is probably not more than $25,000 out of this entire study. And most of it's going to be done just by 2 blood draws, looking at markers and following by questionnaire to see if we've stopped long COVID. Do people not get PASC after they've done this? So, I mean, we don't have a good regimen now to stop these long haulers from happening. So I adjusted the study because I think that's going to be an important consideration because nothing's really been published from that point in prevention. So I think it's going to be done, but I'm not quite sure still what the holdup is at this point.
Well, all I can say is for those of you who are watching this now or will watch it later, we can choose what we want to do. We don't have to wait for a study to be done. We can go to cangetbetter.com and look at the protocol, reach out to Dr. Horowitz if that's what you want to choose to do. Now, if somebody wants to join your study that you're doing, how can they get a hold of you?
So the email, which is medical at, and then it stands for Hudson Valley Healing Arts Center, medical at hvhac.com. I mean, primarily we're looking at, enrolling 50 or 100 long haulers, people that are chronically ill from COVID that have not been able to get help with anything their doctors have done. We want to try this ivermectin glutathione nutraceutical because the early examples we have, it's only 4 or 5 people. Is it reverse the symptoms? Now I have to find out, 4 to 5 people is nothing. I have to find out with at least 50 to 100 people, am I on track? Because then again, you would want to do a larger randomized trial. So, I'm interested in helping the population at this point. For Lyme, I've done what I can to help the community. I published a 2-month effective protocol with double dose dapsone. It was published around 6 months ago. My wife is going on 3 years, no symptoms. She was sick for over 30 years.
Wonderful.
I just had 2 other patients sick for years. They're 2 to 3 months out, doing great. So I've taken the field as far as I can go. Right now, university researchers, the government, people have to do what they have to do. But I'm interested, if you're in medicine as long as I am, you have to find ways to regenerate yourself and not get burnt out.
Yeah.
The way I do it is, we have a new pandemic. What can I do to help? Right. So, I take what I've learned from medicine and Lyme and I apply it. And thank God, it seems like I've come up with some things that are helpful. So, if someone is out there and sick, I would first go on the website, look at the protocol and ask your own doctor to prescribe it for you, right? I don't need the business. If you do it, however, with your doctor, I would love you to email me and tell me what happened, because then I can still send you a questionnaire and still gather data, right? So I don't need the business. I don't need you to come to us, but if your doctor won't do it, and it's a very easy protocol, then if you want to contact our practice, because I'm interested in publishing on this, I think we may have solutions, but I just need larger numbers to be able to see what we've got.
Well, I love it. And I'm going to be a part of that this weekend. When I send out my blog, I will make sure I have this information in our video today so that people can reach out to you and maybe try your protocols so that they can share with you the good news and how they got better. So if any of you are still having symptoms after COVID, you know what to do. The email is medical@hvhac.com. And so, Dr. Horowitz, thank you so much. Every time you come on, I feel, how the Grinch's heart grew like 3 sizes too big or bigger? I feel like my brain just like exploded because it's information that it's at our fingertips that we can choose to take our health back. And I love how you are an advocate of all of us MDs, medical detectives that want to get better. So thank you, Dr. Horowitz, and I'm looking forward to our next conversation. So we're going to say goodbye for now, and I hope that you will share this video, make sure that people figure out why they can't get better. This is you, Guy. Well, we'll see you. Bye.